I have seen many cases of vasovagal syncope in my clinical practice, and today I would like to talk on this topic. So, this is also called neurocardiogenic syncope or reflex syncope. So, what do you mean by that? Is that when there is a trigger or a precipitating factor, it leads to reflex parasympathetic activation. That's why it is called reflex syncope. Let's suppose there is some intense heat, or patient received some very sad news that lead to emotional disturbance, or patient is standing in a queue for a long period of time. So these are some of the common precipitating factors that I get when I ask patients about their triggering factors. So when there are these precipitating factors, then what happens that there is increased activation of parasympathetic nervous system. So when parasympathetic nervous system is hyperactivated, it leads to slowing of the heart rate, bradycardia, right? It can even lead to sinus pause for a few seconds. And when heart stops, what happens that cerebral perfusion decreases, because heart is pumping the blood to the brain against the gravity. Another thing is that parasympathetic activation leads to vasodilatation. So when the blood vessels inside the body dilates, what happens? The pressure exerted on the wall decreases. When the blood vessels is narrow, then the pressure that the blood exerts on the wall is more. But when it dilates, the pressure decreases. And when the pressure decreases, what happens that it is not able to perfuse the brain, because it has to push the blood against the gravity inside the brain, right? So that leads to decreased cerebral perfusion. So one is cardio-inhibitory role, second is vasodepressor function. What I mean by that is vasodilatation. So this occurs transiently, like for 1 or 2 minutes, and afterwards, due to subsidence of this intense parasympathetic activation, patient regains consciousness. So this is a state of autonomic disturbance. So before a patient loses consciousness, prior to that, patient may experience nausea, or there can be a sensation of warmthness or coldness in the body that patient may feel before losing consciousness. Bystanders might notice that patient looked pale before losing consciousness. So why it happens that I told you that the blood vessels dilate. So internal blood vessels like aorta, the major branches of the aorta, those dilates. And when there is dilatation, it cannot perfuse blood to the brain. So to maintain the blood pressure, these bloods from the superficial vessels, like from the skin, gets diverted inside the central circulation. So when this blood gets diverted inside the central circulation, it might look pale, right? Or due to low blood in the superficial circulation, in the cutaneous circulation, patient might feel cold. So the prodrome looks like either feeling of warmthness or coldness, or nausea due to decreased blood supply to the chemoreceptor trigger zone, or patient might experience palpitation. So I told you that there is bradycardia, but you are telling again that palpitation. So how does it can occur? Yes, even in bradycardia, patient might feel palpitation, because if the heart rate is slow, it has to pump forcefully, and that patient might feel that sensation. So palpitation does not always mean cardiac arrhythmia, it can also be in reflex syncope. So these are some of the prodromal features that can occur in neurocardiogenic syncope. And after patient regains consciousness, there is a state of postdrome, and in that patient might feel fatigue for like 5 minutes or 10 minutes, and this is typical of neurocardiogenic syncope. In cardiac syncope, you don't see this type of postdrome fatigue, right? And there can also be pallor during the postdrome in this neurocardiogenic syncope. So based on these clinical features, we can differentiate neurocardiac syncope from cardiac syncope. And especially in younger patients like age less than 40 years, these predromal and postdromal features are prominent. But in older persons, these patients may not be typically present. If these features are not typically present, it does not mean that it is not cardiogenic syncope. I have seen many elderly patients with neurocardiogenic syncope and who did not describe these classical presentations. So this is what I told you, that this is a classical presentation of neurocardiogenic syncope in a younger patient.